In the headlines, the Ministry of Agriculture honors its pledge to empower banana and plantain farmers. 2 regional airlines join sponsors of this year's Jazz and Creole Festival. And the United States appeals to the UN to recognize opposition leader Juan Guaido as Venezuela's legitimate president. I'm Andrea Lee with the Channel 5 News. Back with the details after this.
Imagine you have Hollywood at your command. Introducing Flow Evil.
Red cheese, gold rings, all black, everything creeping through the night.
Anywhere you are.
Big girls don't scream hard like Halloween, make me feel alive.
There's a world of entertainment here, and you run the show. Flow Evil.
Here are some tips to reduce mosquito presence in and around your home. Keep water storage containers properly covered. Remove containers that can collect water from your surroundings. Keep garbage bins tightly covered. Pick up your litter and remove all tires from your yard. Keep gutters free of leaves and twigs to prevent stagnant water. Prevent Zika, dengue, and chikungunya. Fight the bite. This is a public service announcement from the Dominica Red Cross.
This message is supported by Flow.
Thank you for staying with us. First up, the Ministry of Agriculture has made good on its promise to empower banana and plantain farmers here. This as the Ministry of Agriculture distributed thousands of dollars worth of equipment to various banana and plantain growers groups on Wednesday. Minister for Agriculture Reginald Austrie says several gaps were identified in the country developing a successful banana industry.
The following problems have been identified as the main constraints to the industry. And those would include the uncoordinated provision of good quality fertilizer and other such amelioratants. The untimely provision of black sigatoka disease management inputs such as spray oil. The unavailability of good quality planting material, and speaking of tissue culture. A lack of ownership of the industry by the farmers, and that is very critical, that we believe that we have to draw to the attention of the farmers that that industry belongs to them.
The Deputy Prime Minister says the government is taking steps to help improve the industry and reduce poverty by supplying the needed tools and inputs to farmers.
The government, in its plan to support and promote the banana and plantain sector, will unveil a two-pronged approach in promoting multiple goals of rural poverty reduction and the enhancement of competitiveness of the commercial producers. Poverty reduction in the control and management of black sigatoka disease is suitably designated locations approved by the Ministry of Agriculture. So we now need to begin to study in detail as to where we put the resources so we can achieve the maximum results, positive results from the use of those resources. As far as competitive advancement is concerned, that would have to include support to commercial banana and plantain farmers. We will have to supply them with material, inputs, equipments to ensure a consistent supply of premium quality products to the hotels, our supermarket, exporters, and Dexia.
Austrie says the ongoing World Bank program will also assist with improving the quality of products received from the country's banana and plantain farmers.
The government of the Commonwealth of Dominica has committed additional resources in its 2018-2019 public sector investment program to promote the immediate to short-term interventions required to restore the subsector, whilst the medium-term interventions will be financed through the Emergency Agricultural Livelihood Climate Resilient Project, and here we speak of the World Bank project. Both public sector investment program and the World Bank interventions will contribute towards the development of a more modernized banana plantain subsector with increased farm productivity, improved fruit consistency and quality, and enhanced climate resilience to ensure stable market arrangements for local and regional consumption from Dominica.
On to the health sector. The creation of the Dominica Public Health Authority is expected to provide authorities with more flexibility in moving medical staff around the country if and when necessary. The Minister for Health says in cases where the expertise of doctors at the hospital is required in the outer districts, the Dominica Public Health Authority will facilitate these changes. The Health Minister says it is anticipated that the changes which will be seen with the opening of the new National Hospital will encompass much more than infrastructure and trained specialists.
While at the beginning we were speaking only to the PMH, or the new National Hospital rather, we recognize the potential for difficulties, because as it is right now, remember we now have a pool of health personnel. As it is right now, for example, if there's an issue at the district, the CMO can, by virtue of his office, can make a phone call and say, I'm talking to the HMD and said, listen, we need a doctor from whatever doctor from Alford Ward to work 2 days at the district, that kind of stuff. If it has to be done in isolation, you can maybe envisage the difficulties there would be, because right now the doctors and nurses at the National Hospital would be under the jurisdiction of the board. And the CMO or the Ministry of Health cannot now just call and say, listen, we need a doctor. So we realize now it has to be broadened into what we call a Dominica Public Health Authority.
This Public Health Authority would encompass both the primary or district healthcare services and the services at the National Hospital.
There's also going to be the need to have public discuss, because some of the changes or modifications, rather transformations rather, people like the word change. Sometimes change brings fear to people. Transformations a little more palatable to them. We might have to consider whether it's worth economic and also management sense to rebuild some of those little village health centers. You know, people like the health center, people, I said, people, you know, a lot of it is to do with emotion. So there has to be a lot of public discourse to try to engage people so they can buy in what is it that we plan on doing before final decisions are made. Because in addition, of course, to the policy view of it, we also would like to know what the public think in some of these transformational changes that we propose.
Still with health matters, Coordinator of Health Promotion, Mignang Shillingford, says the primary healthcare officials have seen a marked increase in the number of people with elevated blood sugar and blood pressure levels following Tropical Storm Erica and Hurricane Maria. Julian Morris has that story.
Shillingford says the elevated blood pressure and blood sugar levels could be due to poor management of the patient's conditions, but she says there were also new cases coming in. NCDs include heart disease, cancer, diabetes, and respiratory conditions.
And we know what disasters can do. And I just want to put in there how climate change can to affect the health and the health resilience of our people. So based on our food industry, what was happening at the time, we know we didn't have a lot of fruits and vegetables. And you know, people changing and eating patterns tend to change during that time. So we had persons eating more canned foods, which can be very salty and processed, and a lot more carbohydrates than fruits and vegetables. So this could have been, in fact, what may have caused the increases.
Shillingford also touched on the Ministry of Health's response to the NCD situation.
Since we are talking about disaster, one of the things we want to do is to be able to map our persons with chronic diseases. So in terms of management in disasters as in terms of NCDs, to monitor them and to ensure that they have their medications and to ensure that they are eating the type of foods that will help better manage and prevent new cases. In terms of diabetes and high blood pressure, we have partnered with the World Diabetes Federation and the other OECS countries where we have gotten a grant.
The $400,000 grant from the World Diabetes Foundation was given to the OECS to implement diabetes management care in the primary healthcare system.
And that is something very significant for us, because if you notice, I mentioned that a number of persons came with elevated blood sugars and blood pressures. That means a hint of diabetes and high blood pressure. Now, this program will go over a period of 2 years. It has about 5 areas to it. One of it is retraining of primary and healthcare personnel in the management of diabetes and high blood pressure. And you'd well understand the significance of that. Of course, as things change and our evidence base becomes available, that our management of these patients, so we'll have our healthcare providers and practitioners being retrained in that management. And it will be diabetes and hypertension.
Meantime, the Health Promotion Unit is concerned with the development of cervical cancer guidelines. Cervical and breast cancer are the leading causes of death among Dominican women.
We have adopted the cervical cancer guidelines for the Caribbean, but it is time now that we do the cancer guidelines for Dominica. A part of that, we are also thinking in implementation of the HPV virus. And soon, maybe in the next 2 months, we'll be having a massive campaign informing the population.
In other news, Chairperson of the Caribbean Chamber of Commerce, Lizra Fabian, has vowed to strengthen relations between the Chamber and the regional and international development partners during her stint as chairperson. Here again is Julian Morris.
Fabian, who is also the Executive Director of the Dominica Association of Industry and Commerce, DAIC, was voted into the post of chairperson earlier this month. This is the first time that chambers of commerce from 16 Caribbean countries have signed a memorandum of understanding to work together for the betterment of its members. Fabian, whose tenure as chairperson runs for 1 year, hopes to set up a well-established body during her term at the helm of the organization.
During my time as chairperson of the network, I really want to ensure that we can really establish this network, first of all, instead of having it as informal. Before the launching of this network, we have collaborated in different ways, shared best practices, documents that could really be of help to the other chambers, but to ensure that we have a better structure. It's the first time that this is really happening, so we are partnering with our development partners in the region, both regionally and internationally. So we want to strengthen these partnerships. We also want to create a platform, a web platform that our members can log on to. If anyone wants to find information, it's easy to come onto, if it's caricham.org, and the persons who visit the site would be able to easily identify Dominica Chambers, see different things that we have, information we want to share, and to be able to have this better connection even with development partners through that.
Fabian revealed that there are 4 key areas which the 16 members have agreed to work on for the chambers to move forward.
First of all, we're looking at disaster risk reduction. In light of what happened to our countries in the last 2 years, we're looking to ensure that our members learn from the process. We also want to collaborate on trade promotion, trade facilitation, and transportation among our chambers, because we realize that there's a lot of trade that can take place, not just importing things from out of the region, but there's value that can be created for our businesses, and also new markets that can be opened for our businesses who are part of our chambers in our 16 chambers of commerce. We're also looking at partnering on knowledge sharing and best practices. So some of our chambers are more experienced, they have more employees as well, and they are doing different initiatives that we can benefit from in Dominica and other smaller countries. And we're also looking at advocacy and membership value to ensure that if there are specific initiatives or even different actions that we could take in our chambers to create more value for our members intentionally, this is a platform to help us to accomplish this.
Vice Chair of the Caribbean Chamber of Commerce is Trevor Theron, CEO of the Chamber of Commerce in Jamaica.
Moving on to tourism developments. 2 regional airlines have come on board as partners of this year's Jazz and Creole Festival. Marketing executive with the Discover Dominica Authority, Samantha Later, made the announcement on Wednesday.
Today, I just wanted to announce formally that the partnership with Liat has borne fruit, and Liat has given a 20% discount on all airfares for persons traveling to Dominica for Jazz and Creole 2019. So this is a real commendment on Liat's part in ensuring that Jazz and Creole is supported, and we encourage persons to quickly book. The booking dates started on April 5th, which was Friday, for travel for the event, main stage event from May 2nd to the 7th. Those are the travel dates. So we need you to actually log on to liat.com for your terms and conditions and book the flights. Any other information, you can log on to our festivals, dominicafestivals.com, for that information.
The other airline which is offering specials for the 10th edition of the Jazz and Creole Festival is WinAir.
Adding to Liat, we have another major partner in WinAir. WinAir has also come on board for support of the Dominica Jazz and Creole Festival this year for only US $280 round trip. Persons can book WinAir and come and enjoy themselves at the Dominica Jazz and Creole Festival. Just make your reservations via their sales office at reservations@flywinair.com, or just call them and you can start booking. The travel dates is May 1st to the 7th. Booking dates started yesterday, so from today you can start booking till the end of April.
As regards the sea travel, Leta says the DDA and the 2 ferry operators which service the island are still crossing the T's and dotting the I's.
With regards to promotions with the Express Diesel or Val Ferry, we're still in final discussions with them. I know there are discussions with regards to excursions coming for the weekend, so we're just finalizing plans with them.
The Jazz and Creole Festival is scheduled for Sunday, 5th May at Fort Shirley in Cabrit, Portsmouth. You are watching the Channel 5 News. Stay tuned for more after the break.
Imagine you have Hollywood at your command. Introducing Flow Evil.
Red cheese, gold rings, all black, everything creeping through the night.
Anywhere you are.
Big girls don't scream hard like Halloween, make me feel alive.
There's a world of entertainment here, and you run the show. Flow Evil.
Les moun ki ni TB estene e ben tousse, moun ki en bonne santé oli wen ka respire se vermine la. Moun ki pa ni bon tempérament kon sa ki ni maladie HIV, alcool, kafine, ti mamay e grand moun bien sensible pour ces maladies ça la. Moun ki ka tousse ni pou prendre précaution le yo en parmi moun en place publique. Couvert bouche ou le ka estene tousse. Visiter docteur e ben place santé. Fini tout traitement yo ba ou sa joine guérison et puis maladie TB. En responsabilité ou aider du bout Sime maladie TB et HIV, protéger corps et les autres.
Welcome back. The Ministry of Health has put a transition team in place for the transfer of health services to the newly completed Phase 1 of the new National Hospital.
The challenge involves continuing to provide healthcare services while simultaneously moving into the newly completed buildings without any major disruption. Hospital Services Coordinator Clayton Bryant says this process will require skilled professionals. He says his management team is confident that the transition to the newly completed facility will take place seamlessly. The 2 newly completed buildings will house Accident and Emergency Department, Medical Lab, Radiology Department, and a Diagnostic Outpatient Department.
We have a proposal, we have made up a proposal or developed a proposal for the transfer or the transition into the new hospital. And it has been quite challenging, as we have said. However, we have, because of the fact that we have not been involved in that significant transfer before, we have requested from the Ministry of Health a transition team. And as I think PS or our Minister of Health indicated, that we have received services from Inter Health Canada. A team which have been on the ground with us for the past 2 days, and in the next 3 weeks, in fact by the 15th or so, there will be a 3-member team from InterHealth Canada will be on the ground with us to ensure that that transition occurs seamlessly. And we are quite confident from what the information that they have provided with us or to us, in that they have had international experience in the UK, in Canada, right here in the Caribbean with St. Lucia, Trinidad, and also Turks and Caicos Islands. So we are very, very confident that that transition will take place seamlessly.
And the UN Security Council met on Wednesday to discuss the crisis in Venezuela. U.S. Vice President Mike Pence addressed the body, calling on the global community to recognize opposition leader Juan Guaido's claim to the presidency. Pence is also demanding that the Venezuelan ambassador leave the room and return to Caracas.
Well, the UN Security Council just wrapped up its meeting in New York City to discuss the situation in Venezuela. We heard from U.S. Vice President Mike Pence, who demanded the UN recognize opposition leader Juan Guaido as president and revoke the credentials of Venezuela's ambassador.
With all due respect, Mr. Ambassador, you shouldn't be here. You should return to Venezuela and tell Nicolas Maduro that his time is up. It's time for him to go.
Pence also announced the U.S. is preparing a resolution for the UN to recognize Guaido as Venezuelan president and reiterated the threat of military action. Russian Ambassador Vasily Nebenzia shot back, saying U.S. plotting creates humanitarian crises.
We have witnessed the same thing in other regions of the world. We heard blood-chilling stories from witnesses settled in the West about the suffering of the people in Iraq, Syria, and Libya. But the real suffering began as a result of Western interference, and people are still suffering today. Do you want the same thing for Venezuela?
Meanwhile, the International Monetary Fund has denied Nicolas Maduro's government access to almost $400 million of cash it's holding. The IMF has not recognized opposition leader Juan Guaido as Venezuela's president, but Guaido has said that when he takes power, his first order will be to take a loan from the IMF and restructure the economy. Former IMF chair and Guaido advisor Ricardo Hausman said the money will be made available only when Guaido is installed as president of Venezuela. Now, this comes after the Organization of American States recognized opposition figure Gustavo Tarre as Venezuela's representative to the OAS. Tarre was implicated in an alleged plot to assassinate Maduro in 2014 and is a senior associate at the Center for Strategic and International Studies, a Washington think tank heavily funded by the U.S. government, the weapons industry, and oil and gas corporations. This, even though Venezuela had begun its process of withdrawing from the OAS in 2017, a process that will be finalized later this month. Meanwhile, blackouts continue to hit Venezuela. The Maduro government claims the U.S. has orchestrated them in an attempt to create a humanitarian crisis as a pretext for intervention. And the United Nations has called for increased humanitarian aid into Venezuela, though cautioned member states against violating principles of humanitarianism. Following a meeting with the Red Cross, President Maduro has accepted more shipments of aid. Reporting live from the newsroom, Dan Cohen, RT.
Imagine you have Hollywood at your command. Introducing Flow Evil.
Red cheese, gold rings, all black, everything creeping through the night.
Anywhere you are.
Big girls don't scream hard like Halloween, make me feel alive.
There's a world of entertainment here, and you run the show. Flow Evil.
Here are some tips to reduce mosquito presence in and around your home. Keep water storage containers properly covered. Remove containers that can collect water from your surroundings. Keep garbage bins tightly covered. Pick up your litter and remove all tires from your yard. Keep gutters free of leaves and twigs to prevent stagnant water. Prevent Zika, dengue, and chikungunya. Fight the bite. This is a public service announcement from the Dominica Red Cross.
This message is supported by Flow.
To end the news, the headlines again. The Ministry of Agriculture honors its pledge to empower banana and plantain farmers. 2 regional airlines join sponsors of this year's Jazz and Creole Festival. And the United States appeals to the UN to recognize opposition leader Juan Guaido as Venezuela's legitimate president. Feel free to contact us at news@marpin2k4.com. You can also access or pause the newscast on our YouTube channel. On behalf of the entire production team, I am Andrea Louis, and to all of our viewers around the world, thank you so much for watching. Join us tomorrow.